In this lesson, we'll step through a critical appraisal of a systematic review using the Faith Critical Appraisal Checklist. We'll be appraising a recent open access systematic review entitled Telehealth versus Face-to-Face Psychotherapy for Less Common Mental Health Conditions, Systematic Review and Meta-Analysis of Randomized Controlled Trials by Greenwood et al. Before beginning the Faith appraisal, we should identify the question the review is asking using the PICO framework. For reviews of interventions, P in PICO stands for the population or problem of interest in the review, I for the intervention being tested, C for the comparison, that is what the intervention of interest is being compared to, and O is for the outcomes. This refers to the factors measured in the review to determine the effectiveness of the intervention. You should be able to do this using the information in the title and abstract. Using the PICO framework, we can quickly check whether the patients or problems addressed by the review are similar to yours, whether the intervention is feasible in your setting, and whether the outcomes are clinically important and relevant to your patients. Here's the abstract from Greenwood et al. You can pause the video at this point to find the PICO elements. From the abstract, we can see that the patients or population of interest in the review are people with less common mental health conditions and physical health conditions requiring psychotherapy. The intervention studied is telehealth delivery of psychotherapy, and this is being compared to the face-to-face delivery of psychotherapy. The review reports patient-relevant outcomes such as symptom severity, overall improvement and function, as well as process and financial or cost outcomes. For this item of the Faith checklist, we need to consider whether the review has conducted a search that would be likely to identify all the relevant published and unpublished studies addressing the review question. Systematic reviews that do not conduct a comprehensive search may miss available relevant evidence. Such reviews are uninformative and may be misleading. We can find the information to answer this item in the methods section of the paper. The methods used to identify published studies in the Greenwood et al. Review included searches of 3 bibliographic databases, including Medline, Embase, and Central, which is a source of reports of randomized and quasi-randomized control trials held in the Cochrane Library. The search string used to search the databases is provided in appendix and appears to include a comprehensive range of search terms that would be likely to identify relevant published studies. They provided the date of the search and indicated that there were no restrictions on the type of publication, meaning that types of publications such as letters, where studies are sometimes reported, would be identified. The reviewers also used other methods to identify studies. Greenwood et al. Conducted a backward citation search, which is a search of the reference lists of studies included in the review. A forward citation search was also conducted. This means that studies published subsequent to and citing the studies included in the review were searched. Though reference list searching may locate unpublished studies, no other effort to identify unpublished studies, such as searching of trial registries or contacting individuals or organisations researching in the area, were used. The results of the searches conducted are clearly described in Figure 1 in the Greenwood et al. Review. Here we can see the number of studies identified through the searches, the results of screening of these studies, the number of studies excluded, with reasons available in an appendix, and the number of studies included in the review. The efforts to locate published studies in the Greenwood et al. Review were comprehensive. More than one database was searched appropriately, additional efforts to locate studies were undertaken, and the results of the searches and screening were clearly reported. As such, it's likely that all relevant published studies were located, so we could tick yes for this checklist item. Efforts to search for unpublished studies were limited only to reference checking. Ideally, other methods such as checking trial registries would have been conducted. We should keep in mind that some unpublished studies may not have been identified in this review. The A in Faith asks us to determine whether the review authors assess the quality or risk of bias in the included studies. This assessment is critical because our interpretation of the findings of reviews are informed by the quality of the studies upon which they are based. We should find this information about whether and how this was done in the methods section of the paper and the results of that assessment in the results section. In the Greenwood et al. Review, 2 review authors independently assessed the risk of bias in the studies included using the Cochrane Risk of Bias tool. This is the ideal method for assessing the risk of bias in randomized control trials, which are the type of studies included in the review. The results of this assessment across all studies and for each individual study included in the statistical analysis are clearly presented in the results section. The Greenwood et al. Review has assessed the quality of each study included in the review, assessed it appropriately, and clearly presented the results of that assessment. As such, we can tick yes for this faith checklist item. To answer the include item of the faith checklist, we need to consider whether the review only included studies sufficiently valid for the type of question the review asks. To do this, we need to think about 2 things. The first is the design of the studies included in the review, and the second is whether only high-quality studies of that design were included. You should find this information in the methods section. Systematic reviews that are based on high-quality studies of the best design, when all other parts of the review are also done well, provide the most reliable and robust evidence. In the Greenwood et al. Review, we can see that randomized control trials were included. Randomized control trials are the ideal design for assessing the effects of an intervention such as telehealth. Other designs that may also be used to assess the effects of interventions, such as cohort and case control studies, which are more prone to bias and confounding, were excluded. So far, so good. However, it does not appear randomized control trials judged to be of low quality, for example, trials that did not use appropriate randomization methods, were excluded from the review. This is not unusual, though. Most reviews do not exclude studies because they're of low quality. An acceptable alternative is to assess the effects of studies at high risk of bias on the findings of the review in a sensitivity analysis. In this type of analysis, we can see how the results are affected by the inclusion of low quality or high risk of bias studies. Greenwood et al. Did indeed intend to do this. However, due to the small number of studies, it was not possible. So how might we rate this item of the checklist? We know that only studies of the best design for answering the review question were included, and that the reviewers intended to assess the effects of the quality of the included studies on the findings of the review. Based on this, and the fact that we are able to clearly see the results of risk of bias assessments for each trial, it would be reasonable to answer yes to this checklist item. Many reviews attempt to combine the results of included studies to give an estimate of the average overall effect of an intervention. It's important this is done appropriately. Reviewers should not simply count the number of studies with positive and negative, or statistically significant and non-statistically significant results. Ideally, the results of studies are combined or pooled statistically using a meta-analysis. In a meta-analysis, the studies are weighted according to the amount of information they provide, with larger studies contributing more than smaller ones. A description of the analysis performed in the Greenwood et al. Review can be found in the Methods section, and the results of that analysis in the Results section. In this forest plot, which is the way results of meta-analysis are typically presented, we can see that each study in the analysis is weighted. Each study contributes to the average estimate of effect, which is represented by the diamond in the plot, according to the amount of information they provide. This is an appropriate method of combining or totaling up the studies, so we would answer yes for this checklist item. For the last item of faith, we need to consider whether statistical heterogeneity, that is, variation in the results of the included studies, has been assessed and explained. This is necessary for us to understand to who, how, and when the results of the review might apply. This information will be in the Methods and Results section of the paper. In the Greenwood et al. Review, the Methods section states that heterogeneity was examined using the I-square statistic, and that subgroup analyses were conducted to examine the effect of time of follow-up on the effectiveness of telehealth-delivered psychotherapy. The I-squared test is the ideal way of assessing heterogeneity because it quantifies the amount of variation in the study results that's due to differences in the populations, interventions, comparators, outcomes and designs of the included studies rather than due to chance. We can see the results of this assessment in the forest plot. For the subgroup of studies assessing this outcome immediately after treatment and 3 to 4 months after treatment, the I-square is 0%, which suggests that the variation in the results of the studies is due to chance. When the outcome is measured at 6 months after treatment, the I-square is just over 40%. This suggests that variation between the results of the studies may be due to differences in other factors than the time after treatment, such as differences in the populations, interventions, or conduct of the studies. Given the small number of studies, only 2, in this subgroup, it is difficult to explore the reasons for the differences further, but it is difficult to apply the findings of this subgroup to practice. Subgroup analysis is a way of exploring variation in the results of studies included in a review. It should always be specified a priori, meaning before any analysis is undertaken, and this appears to have been the case in the Greenwood et al. Review. As subgroup analyses are observational in nature, the results should be interpreted with caution. As Greenwood et al. Undertook an assessment of heterogeneity in the results of the studies included in the review and took steps to explain the variation, we would tick yes for this checklist item. We've reached the end of the faith appraisal of this systematic review. The faith checklist has focused our attention on the key aspects of the review methods that can lead to the introduction of bias. As this example shows, we can do this assessment quickly by focusing our reading on the methods and results of the paper to give an overall picture of the validity and trustworthiness of a review. We judged that Greenwood et al. Used methods that would be likely to find all the relevant studies addressing the question of the review. The search for published studies was comprehensive, and there was some searching for unpublished studies, though this was limited. We should keep in mind that some unpublished studies addressing the review question may not have been identified. We considered that Greenwood et al. Assessed the quality of the included studies appropriately and reported this clearly. Studies of the ideal design for answering the review question were included, and though not only the high-quality studies of this design were included, Greenwood et al. Considered the effects of level of study bias on the results in a sensitivity analysis. The results of studies were combined appropriately, that is, the totaled up item of faith, and heterogeneity was assessed and explained. As all the faith items have been answered as yes, we can be confident that the risk of bias in the review is low and that the findings of the review can be trusted. We hope you've enjoyed this video. If you have any comments or suggestions for improvement, please use the contact information provided here. This video was developed by the Institute for Evidence-Based Healthcare at Bond University with support from the Council for Allied Health Professions Research, Northern Ireland Hub.